Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, The Answer Company. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. The Minnesota Twins are looking forward to another great season in 2023, led by the return of All-Stars Carlos Correa and Brian Buxton. With the return of numerous players who were injured in 2022 and some new acquisitions, another division crown and a return to the World Series are in their sights. Established in 2007, 45th Parallel Spirits was among the first 50 micro-distilleries in the United States. Based in New Richmond, Wisconsin, all aspects of production occur at our facility. If you're interested in visiting and learning more about the 45th Parallel Distillery, please check our website and plan a visit to tour our facility and taste our spirits. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org.
Welcome to another episode of Access to Democracy. I'm your host today, Steve Francisco. It's my pleasure to welcome to the studio a first-time guest on Access to Democracy, Julie Bluhm. Julie is the Chief Executive Officer of Guild, which is a nonprofit that provides services to Minnesotans suffering from mental illness and long-term homelessness. Julie, welcome to Access to Democracy.
Thank you so much. I'm excited to be here.
So I understand you earned a master's degree in social work from the University of Minnesota. What drew you to a career in social work?
Oh, that's such a great question. I think I've always known that I wanted to help people. I grew up Catholic in St. Paul, and the first thing that excited me about Catholicism was when they announced a social justice committee in the church, and I really started to learn about how the culture I grew up in was really based around this idea of social justice, and how I just, to me, that just sort of stoked a fire. I also experienced some mental health challenges with friends and myself growing up that really felt like a purpose for me, that I could make a difference in that field. Yeah.
And I understand that you've previously worked as a patient advocate. You've been a mental health therapist. You've worked at a center for women experiencing mental illness, and that you were director of Hennepin Health's Clinical Innovation. Say a little bit about what that career experience did for you and what you learned and how it prepared you for the job that you have now.
Yeah, that's such a good question. I've had a varied career, and it's really been driven by what I'm interested in, sort of what I want to impact next. So first and foremost, I am a social worker, and one of the things that people don't know about social workers is that embedded in our code of ethics is the mandate for standing up for social justice, again, that word, and to advocate for people. We're going to
hear a lot about that theme repeating.
To advocate for people and to advocate for systems that can actually work for people. And I learned early on, so my first job was the patient advocate at an amazing clinic called Broadway Family Medicine in North Minneapolis. And my official role was signing people up for medical assistance or Medicaid so that they could be seen. What the role really was my office was just right off the lobby, and anyone who came in who had anything that the doctors deemed social issues, they could come and talk to me. And so I learned firsthand through people's stories and interacting with individuals about all of the challenges and barriers that our systems that were built to help them as a safety net were just failing people. Not working. And so for me, that realization led me to getting my master's in social work, because I knew that social work had the opportunity to do more clinical work, like being a therapist and actual treatment provider, and at the same time is a very broad education that's based on systems change and advocacy as a part of our ethics. So that led me, so I really wanted to be an expert in mental health. I thought, if I want to, later in my career, talk about mental health policy or systems change, I really felt that it was important that I understood the work on the ground. And I'm really glad that I did, because it's really helped me to be a better leader.
It gave you a good foundation for what you're doing now.
Correct.
So tell us a little bit about what Guild is.
Yeah.
What is it? How many staff do you have? And where are you located at?
Great, yes. So Guild is serving mainly the East Metro area. We have services in the 7-county metro area, but most of them are in St. Paul, so Ramsey County, Dakota County, some in Washington County, Scott County, and we've been just starting to do some rapidly growing homeless outreach in Anoka County, which has been really exciting. So Guild has about 200 staff, and we have 4 different locations. 2 of those are what we call intensive residential treatment, so a place where someone would go to stay for up to 3 months to stabilize and get treatment for their symptoms. And attached to both of those buildings are crisis centers, so places where people can stay for up to 10 days just to get stabilized and then go right back into their community. And then we have our administrative offices along with staff offices in downtown St. Paul, just right across the Wabasha Bridge, and then a client drop-in center in West St. Paul. The treatment centers are South St. Paul and Savage, Minnesota.
And you also do, as I understand from your website, you do outreach. You don't just wait for, not everyone can come into one of your offices or clinics, that you have staff who go out to where people are on the street. Say a word about that, too.
Yeah, in fact, it's really just those 2 treatment centers and our drop-in center. And the treatment centers are just 16 beds. And the drop-in center has about, I would say, about 100 clients who are coming in and out. Otherwise, the rest of our services are in people's homes or where they happen to be. And that is one of the things that makes us proud and unique, is that a lot of people, when they think of mental health treatment, they think of going to a therapist's office and having an hour therapy session and then going home. We're really there for when they go home. We help them arrange a therapy appointment. We help them find a therapist that, works with them.
And is there transportation to get people to appointments?
Absolutely. So our staff are out, driving out to people's homes, driving them to their appointments, helping them get whatever it is that they need to stay in the community. And I know we're going to talk a bit about the history of Guild, but its history really cements that, and that's how it's living and breathing now, is that we know that people can be independent and live autonomously. We know that.
And actually, that's a nice lead into the next question, because I think the story about the roots of Guild, how it started, is really interesting. Tell us, how did Guild start? Where did it start?
Yeah, so in the early 1900s, a group formed called the Guild of Catholic Women. And it was a group of Catholic women in St. Paul who are interested in social services and in making a difference in their community with people. They did a lot of different things, but in 1970 they found themselves with an empty building that used to be used. It was a dormitory style environment that used to be used as chaperone for young Catholic women who were coming to the city to work. So I think of like Mad Men with the secretary's dorm. That's how I picture it. But they had this big facility called Guild Hall, and in the late 70s we were committed to, as a country, deinstitutionalizing people who had mental illnesses. Unfortunately, the reality of that was just closing hospitals without really providing the infrastructure or building a system that would help people remain in their homes. And so the end result was that the state hospital in Hastings closed, and they were people, many people, who had nowhere to go.
Yeah.
So Ramsey County, the State Department of Human Services, reached out to the Guild of Catholic Women, knowing that they had this building, and said, will you take some of the people who have nowhere to go? It ended up being 66 people.
The original
clients in Guild Hall. The thing that just blows my mind is that the women, a volunteer group of women, ran the facility for 10 years before they had any staff. And so I just think about the level of organization and commitment that would take, because these were people who were hospitalized for a lot of their lives.
And this is not easy work. It's very intensive, very emotionally challenging for the caregivers.
We didn't have good psychotropic medications. We didn't have, So it's pretty, I can't imagine something like that happening today, to be honest with you. So eventually the Guild of Catholic Women realized that this was a really important mission, but they wanted it to live outside of this organization. And so they spun off into Guild Incorporated, which was incorporated in 1990.
Yes.
And has grown ever since. And now we're just Guild.
And you no longer have a formal affiliation with the Catholic Church, correct?
Correct.
Yeah.
Yep.
It's interesting in looking at the website for Guild, and I attended a fundraising event that your organization had in December, which I shared with you before we started recording today, that it actually was one of the best nonprofit fundraising events I think I've ever attended, because the way the information was presented to donors about your work, hearing testimonials from people whose lives had literally been changed and people's lives that have been saved. It was remarkable. But I wanted to touch on this theme that your organization has, that you offer an integrated approach. Now, there are organizations in Minnesota, as we know, that serve people who are homeless. There are other organizations that serve people with mental illness. There are organizations serving people with substance abuse issues. Tell us a little bit more about what does this mean, an integrated approach to dealing with these issues?
Yeah, we've known for a very long time that people come with lots of different problems, and that to just be able to say that they just have a mental illness is not serving the whole person. And so I think very early on, Guild, and that's where I feel like our core value of innovation comes from the Guild of Catholic Women. We're not going to say no. We're going to figure it out as we go, and then learn from what we're doing and try different things. And so so we are talking a lot now and talking about integrated services, but I would say Guild from the start talked about, we have clients that have multiple chronic conditions. People with serious mental illness on average die 24 years earlier than people who don't have them. And it's a lot of chronic conditions, a lot of medical neglect. And we know that people also have substance use disorders, because mental illness can be self-medicated sometimes with substances. That's how we use our medications to manage symptoms. And a lot of our clients with serious mental illness are having a really hard time maintaining their housing or are ending up unhoused. And so for Guild, our array of services was intentionally built around the concept that we want people to have an opportunity to live in the community of their choice, to not have to stay long stays in hospitals. If they do have to be in the hospital, to get them home quickly. And so that's why we developed a housing program where people can live in apartments wherever they want, and we find landlords who will take vouchers.
Julia, I was going to say, it seems like this integrated approach, it enables you to address multiple issues, because if you didn't do that, you might not be solving the primary issue that a person presents with, such as homelessness. Or mental illness.
Right, because as I talked about as a social worker, realizing we wanted to do something different, it's not enough to just be a team and say, well, I handle the mental health, and I handle their heart, and I handle, we all know that.
It's interesting. Our country has treated the problem of mental illness in a very different way from many other developed countries in Western Europe and Canada, elsewhere. That we've had this terrible stigma that's been associated with mental illness, and that stigma has worked its way into public policy. We had this very intense debate in the country a few years back about, was health insurance going to be required to cover people with mental illness?
Right.
The late U.S. Senator Paul Wellstone made this one of his signature issues during his career.
Yeah.
And others have fought for that too. And then we had Obamacare, which we've started to see some changes in that policy. Aren't those a good thing for us to recognize that, a person may have mental illness, and we shouldn't be treating that differently than somebody who's diagnosed with cancer or diabetes or other healthcare issues?
I would actually just to say that sadly, we're not alone in the United States, because Canada has a national health service,
That's right.
but they don't have mental health benefits unless you have some additional, riders that you can purchase, right?
That you can purchase, okay.
And so we really are not alone in the world in not understanding how to best serve people. I think where we are extraordinary, though, is that we don't see social services, spending on social services, so people can be healthy as a part of the whole picture of mental health. So you're right, mental health parity was passed in honor of Paul Wellstone. It still is a dream. It's still something that we have multiple bills each session to sort of chip away at another way to hold health plans accountable for covering mental health at the same level of benefits as they would with physical health. And yet I think we also understand, our hospitals are overflowing, people are waiting so long. And we know that other countries have said that a universal basic income, or ensuring people have, their basic needs met, that they have housing, that does a lot to help people prevent being, decompensating and needing a hospital in the first place. And so I think that's really where we need to focus.
So what is the scope of the problem of mental illness in our society? Is there a way that we measure it? How many people in any given year suffer mental illness that requires treatment?
So NAMI's, the National Alliance on Mental Illness, we have a great chapter in Minnesota, does a lot of great research, and you can go down that rabbit hole on their website to find. But what we know is that 1 in 5 people will experience a mental illness.
20%
20% of people.
Yeah.
As a mental health professional and a person, I believe that we all have mental health. We all have mental health, right? And it's a continuum. And some days my mental health is good, and some days it's not so good. And I think what we're seeing now, as we get better at reducing stigma, our young people are talking about their mental health at rates that I never talked about my mental health.
I have to say, I've noticed that the pandemic has sort of opened this Pandora's box too, in a way, that you hear people talking about this, admitting that they have suffered from depression during the pandemic when they were isolated. Maybe they weren't in school because the school was shut down. They weren't in their workplaces they normally would have been. And so, in a sort of perverse way, the pandemic has helped us bring this issue out to the front for people to see.
I think so. I think so in a way that it wasn't before. It was starting to become something we talked about more, but I think the pandemic truly sort of put it over the edge, because there's so many people who are in crisis. And
so tell us, how did the pandemic specifically affect Guild? How did it affect your staff and your clients?
So I started at Guild in 2017, and I kind of have in my mind like a before and an after. With the pandemic in the middle. I mean, I think, with all businesses, we did things that we just never imagined we could do. I never imagined that my staff could work from home, or that I could have a job where I'm working from home for a year. So with Guild, we were very fortunate that we had a grant from the Otto Bremer Foundation to purchase mobile computers that were, like, our staff were using iPads, which weren't working as well for them. You know, they were old. And so we had purchased a lot of computers through that grant that came in literally the week before we ended up all like just going home on a Wednesday. And our brand new IT manager sat in the conference room and just handed out and uploaded and got all these computers out to our staff.
Thanks, Otto Bremer Foundation.
Yes, absolutely. Wow. And so that was like so fortunate that we had that right before. So our staff were able to be remote. I think that the hardest thing for us, well, there were a few things. One, our 2 treatment centers could not be remote. They're open 24/7. People come in and stay there. So trying to keep the clients healthy and our staff healthy in those environments, and especially at the beginning, the staff were really scared. I mean, none of us knew, right? And so really felt like they were putting their lives on the line by going to work.
Right.
And then I've got another part of the workforce that's working from home. And thanks to some federal legislation that came through pretty quickly with the emergency order and with our advocacy partners' help, allowing us to bill for telephonic and remote visits. And so prior to that, we'd have to just do in-person visits with clients.
Which limited who you could serve then, right?
Well, because we go out into the field, not really. I mean, I think in mental health in general, when you were talking about the outpatient therapy where you come to my office, for sure, it helped with access because people could then, they're not no-showing as much because they don't have to like get to the appointment, right? They could be in their house. And so that I think is here to stay. I think that that's really important. Our clients, it was harder because we have homeless clients who don't have phones, right? So a lot of our outreach staff were still out there during the pandemic, but the staff that managed people usually by visits to their home, we're able to do a lot by Zoom or Teams, and you know, over time, once we sort of got used to what that was like, our staff had some really great stories about how effective they felt like it was. And so I'm glad that the teams are all back in the field, just because I think my takeaway is I think it's okay to have, you know, we had an existing staff that was on site and then moved, and in the community, and then moved remote. But once we started having a lot of new staff coming on, it was really challenging to make sure they felt a part of a team.
So there were some real lessons that you learned as a nonprofit and a service delivery nonprofit about how you become flexible and do this job in a way that responds to circumstances on the ground, in this case the pandemic.
Yeah, absolutely. And knowing that for many of our clients, the fact that our staff weren't going to their house, they didn't have anyone checking on them.
Do you see any of these changes becoming permanent in the way Guild delivers its services?
Not so much, because we are so hands-on. So we talked about transporting people, going to homes, finding them outside, and working them into housing. So most of our work is done in person. But what I don't feel as nervous about is what if, right? Like, what if we couldn't go out for a week? Before the pandemic, it was, how would we get people medications? You know, how would we? And now we've kind of figured that out. So it doesn't feel as, it feels more stable in that way. Yeah.
Time is starting to wind down. We're down around 5 minutes. I want to ask you, could you give us maybe one brief story or one or two brief stories about success stories about how Guild changed people's lives?
Yeah, we are storytellers, like you said. So I think, you know, one of the gentlemen that comes to mind, and they let us tell their story, so it's okay to use first names. His name is Edward. I always think of people with their names. Edward was a really hardworking person who had been in the military. He was a married father, and worked really hard. And his wife decided not to be married. They got divorced. But she wasn't working, and so he was supporting his ex-wife and his daughter while he was working. But he also needed to afford his own apartment, and that's really was the thing that that became not sustainable. And so he would work, 40 to 60 hours a week. He talked about working multiple jobs just so that he could rent a motel room so he'd have a place to visit his daughter and to spend weekends with her. But the consequence of that was that he could not afford his own home. And so he was working for a rental truck company and sleeping in the trucks. And he said he did this for several years, getting a hotel room on the weekends so that he could be with his daughter, who was his, most important priority.
And Guild was able to help him.
And eventually he was caught and ended up getting referred to Guild. And so we were able to get him his own apartment where he could have his daughter and he could continue to work and provide both for his daughter and for himself. And without Guild, that just wouldn't have been possible.
That's a great story,
Yeah.
and I know it's probably just one of many stories that you
Yeah.
could tell us. Time is winding down. I don't want to get to the end of this interview without you giving our viewers some information. What can they do if they're inspired to volunteer or donate to Guild? Where can they go to do that?
That's a great question. We have a website, we're guildservices.org, and on there we have ways to be involved. We really ask our donors and supporters to help with advocacy, to talk to their legislators, and we have some priorities there, but we also have some volunteer opportunities, so we'd love for people to go and find out more about us there.
And the event that you had in December, which I should mention was at the Intercontinental Hotel at MSP Airport, a tremendous event and a large number of volunteers that you had staffing that event that day.
Yeah.
But it's really remarkable. I guess one last question I'd like to ask you, Julie.
Yeah.
What do you see as Guild's greatest accomplishment or achievement?
I can't think of just one because we've had such a rich history. But what I would say is, I kind of mentioned it earlier, it's not being afraid to just take things on and learn new ways. Everything that we have done, every intervention that we provide has been on the front end when the state, has just decided that we want to provide a certain evidence-based treatment. And we have been the first ones to say, yeah, let's give it a try.
Let's do it.
Let's pilot it. And the results of that is just tremendous quality of care, and one of our core values is perseverance. We just don't give up, and that just lives throughout the organization.
That's really wonderful. Julie Bluhm, CEO of Guild Incorporated, your organization is doing tremendous work in our community, again, helping people dealing with mental illness and addressing long-term homelessness and helping in myriad other ways so that people can live better lives. And when they do live better lives, our communities are stronger for it, and we all do better.
Absolutely.
Thank you so much for being with us today on Access to Democracy, and hope we can have you visit us again sometime in the future.
That sounds great. Thank you.
Thanks, Julie.